Okay, Corey, you ready? If you're ready to turn it on, I'll go ahead and start this meeting, call it to order. Thank you, everyone that's here, for coming to our Behavioral Health and Housing Subcommittee meeting for March. Call this meeting to order. And the first order of business is approval of the minutes from February. If everybody's had a chance to read them, I'll ask somebody to make a motion to approve them.
I'll make a motion to approve the minutes.
Thank you, Dane. Do I have a second?
I'll second.
Thanks. Thank you, Sarah. Moved and seconded to approve the minutes from February 25th. All in favor, either say aye or raise your hand. Anybody opposed? Looks like it's unanimous, Corey. Thank you. So our next order of business is connecting point update. So Dane, you have some statistics for us.
I do. Number one, the shower trailer's back up. It came back up last week, so that's awesome. That should draw in a few more people, but we did serve quite a few people. I couldn't share it, but I'll read it. We had total services of 313 people, 137 of those identified as male, 112 female, 64 we were unknown on how they identified. Ages, we had 102 people. Actually, Mary was really good about getting ages, but you know, pretty dispersed. 18 to 30, about 34 people, 31 to 50, 46, and then 51 to 64, 22. We didn't have any over 65 this time, but we typically do have some 65, like, you know, a few numbers. So that's concerning when retired 65 and older out living out on the streets. We did get client IDs out of 121 of those. When I unduplicated that number, we served 108 individuals, 62 of those male, 38 female, 8 described as non-binary or trans. Our best services were like miscellaneous resources. Mary's got a lot of different things out there. So she served about 167 people with like bags and just different resources, pins, and hygiene and sanitizer was our next. 143 individuals took hygiene and sanitizer. Naloxone, 122 people. Wound care, 93. Food resources, about 90 people. Next services, 83 people. Socks, 82 people. Fentanyl test strips, 59 people took those. And then smoking supplies, 49. Condoms, 39. Pet food, 25. And 18 actually got live testing out on the street. Seth's been really good about trying to collaborate with some testing resources out there. So hopefully we continue to grow that number and get people a baseline on HIV, Hep C, and syphilis. But any questions on that? I think we did it.
Those are really,
if you didn't know,
really impressive.
We did start Drain this last month, so that's exciting. And it went really well for the first time. Myrtle Creek has been going great. Darlene did tell us the church flooded, but they got that all cleaned up for Myrtle Creek. But that one's been really well received down there, the Drain one. And then we're working on maybe doing a collaborative towards Reedsport here soon. We'll get you some more information on that. But, you know, 5 days a week we're out there. A few of the services have been a little slow. I think the disruption and movement around the city and safe camping locations causes disruption. And so, but consistency of the connecting point initiative and being at certain locations has been great for people to find us. So they'll come back. Like the Seventh-day Adventist Church is an example. And I think having the shower trailer back up and running really is one of those draws. But the neat thing is I'm getting a lot of phone calls and texts on the connecting point flyer. And so they're seeing our flyer out there asking for resources. And it's great. Like, if you didn't know, you can go to Corey's website on the LPSCC. Those resources, you can just drop them in a text to people and they open up. Like that resource guide is just, that's usually my first step is like, hey, here's a resource guide. Has all the different resources, the crisis number, housing, for immediate needs and such. But if you're not doing that, I would encourage it. But people are seeing our flyer, Corey. Great job. Thank you.
Welcome.
Okay, any questions for Dane? I think those are impressive numbers, Dane. Did the rain event disrupt anything for you? Was there any other problems that were existent that you don't normally have?
No, the rain really didn't. I mean, people still came to serve. I think it was a little slower last week, but you know, I think that had to do with people flooding and where they're camping down near the point. They did sweep the point this last week, and I think they're sweeping some other areas that they're identifying. So there could be some challenges out there for people. So if you have resources, just send people out and connect with them and see if they need a tent, tarp, and sleeping bag. The city did ask that if you are distributing those needs to make sure you unbox them because they found a lot of boxes just dispersed, and so please take the boxes out and dispose of the cardboard and stuff. It just makes it a little bit easier when the city's cleaning up areas.
Thanks, Dane. Thank you very much. Any questions for Dane? Okay, thank you. Moving forward, behavioral health updates, ADAPT integrated healthcare programs, highlights, and successes. Cheryl?
Hi. So I will start with the impacts program, and to date in Q1, with just about a week left, we have provided 786 services during 522 different encounters. 60 of those were during jail in-reaches. Our overall cohort is up to 675 individuals. But 134 of those individuals are currently meeting our criteria of having 4 or more incarcerations within the previous calendar year. So those are the focus of our cohort outreach efforts. Interestingly, we do have several people from the original cohort who are still currently meeting that criteria. Just a handful of them, but we're really trying to focus our efforts there. Our Impacts Outreach Navigator is now able to perform ASAMs in the jail. So that's really exciting for us. We have our first case where we were able to go into the jail, do the ASAM, get everything set up to have treatment happen immediately upon discharge from the jail. So they discharge on a day next week. We're going to pick them up at the Sally Port, take them straight over to their PO and straight over to treatment. And it's just going to be beautiful, taking advantage of that change moment for people. So we're really excited to see where that goes. Crisis resolution rooms got a lot of use last week. What we saw from our folks is that mobile home parks and trailer parks seem to be heavily impacted by the flood last week. And so we had a number of people who lost their homes and were able to take advantage of using the crisis resolution rooms. And I think that's really one of the biggest benefits that those rooms have demonstrated is oftentimes it takes the Red Cross a minute or two because they're not local. They have to come in from out of town. And so it takes them a minute or two to get here. And so in cases like flooding, fires, or other sort of larger community disasters, we can provide, and we have provided those rooms for community members to stay and have a safe place until they can take advantage of those resources. So we gave 26 individuals a total of 44 stays, a lot of repeat people there. Almost all of them received crisis case management, food items, crisis counseling if we were able to, transportation. We're providing naloxone in each of the rooms and peer supports following that crisis interaction. I don't have new mobile crisis data because I will be pulling it at the end of Q1. What I do have is an updated report from OHSU showing some of these beautiful data stories. They collate all of our data into graphs and charts and then compare them to statewide numbers. I'm looking at the statewide report right now. And we are second in the entire state for counties having the highest call volume. I think, and we're second only to Lane County that has had cahoots for the past 30 some odd years. So I think that's a really big testament to the work that we're doing and the relationships that we have with law enforcement and other first responders in the community, that we're able to outreach that number of people and hopefully have some impact on people's lives and their ability to access services. So we had a high number of successes too with our youth stabilization. So for the last year, we've been operating a mobile response and stabilization program, and that is where anyone under the age of 21 who receives a mobile crisis contact, they and their families are then admitted to 8 weeks of stabilization services following that crisis event. And we had about 50% of our youth and their families take advantage of that services. And we were able to reduce the impact of crisis and further crisis from happening during that 8-week follow-up period. And then, so I'll send these 2 reports out to Corey. They're really fascinating to look at. It gives you a really good idea of what's going on in the county and then also what's going on around the state. So our sobering center continues to see a large increase, the highest utilization we've had to date. We had 64 different sobering services for 31 different individuals. We are taking a look at that because what we're seeing is we had an individual recently who we don't want to turn someone away from a voluntary admission. But in this case, someone showed up at the door and said, I'd like to come in and be admitted. They didn't meet our admission criteria, so they went next door and used a substance and then came back. And so we want to think of ways to really embrace our population while also setting some boundaries and not enabling substance use. So we're working with that to maybe limit voluntary stays to a certain number per year, or we're thinking of ways that we can really help support people in those moments. I think it's also really interesting. I'll send this number out to Corey also. Of the 64 admits, 43 of those were brought in for mobile crisis. So I don't think that's a true number. I think when we dig down a little bit, because mobile crisis can provide safe, secure transportation in a cage-like vehicle, much like law enforcement can, they are oftentimes doing the transportation for law enforcement, freeing up some law enforcement time. So we're trying to separate that number a little bit and keep getting good data about where the admits are coming from, what specific agencies or law enforcement organizations are coming from. But we still have just excellent use, and we are really thankful that the Sobering Center appears to be serving the purpose that we intended it to serve in the community. So that's what I had.
Oh, thank you, Cheryl. And I'm very impressed with the fact that, and I think both Mobile Crisis and the Sobering Center are definitely doing the job that they're meant to do, because it certainly takes a load off of the law enforcement community when these 2 things are available, even though they might be tangentially impacted a little bit. They actually are not, these people don't need to go to jail necessarily. So I think the mobile crisis especially, and I've always been impressed by the fact that Douglas County is one of the best in the state at providing the mobile crisis unit. So kudos to all those involved. Thank you very much, Cheryl. Any other questions for Cheryl? Okay, thank you, Cheryl. Moving forward, our next Mercy Medical Center Behavioral Health Unit is Lindsay's not here. Is somebody else here, Corey?
Not that I see, no.
Okay. Roundtable for other organization behavioral health updates. Anybody else on the group want to share some of their behavioral health updates?
Jesse's been open
Nobody
for a
raised
while.
it.
I don't know if Jesse has
Oh,
an update.
there's Jesse. Oh, there he is. Yes, Jesse. How was your grand opening?
Looks like he's talking
I
to
think you're
someone else.
muted, Jesse.
I think he's talking to someone in its office.
Oh, okay. Okay. We'll come back to Jesse. Yeah.
Okay.
Going forward, Housing Authority for Douglas County updates. Janelle's not here, but Corey, you have her notes.
Yeah, she just done something really short. So Janelle said for HADCO, it was business as usual. The Section 8 program is currently not leasing due to waiting on HUD budget authority. So vacancy for all programs is very minimal, and they have their wait lists are growing longer. And then she said with HTAG, discussions continue on how best to address needs of the unhoused and encourage collaboration with community partners, which also included the city of Roseburg. And that's all she sent for that.
Okay. So you said they're waiting for HUD to decide what they're going to do.
Yeah, they're waiting for their budget. Like a lot of places, I was just on the state mobile crisis behavioral health group, and a lot of people are in a holding pattern because of freezing with federal funds, and they're waiting to see what will be released and move forward on budgets. Some are waiting on legislature decisions. Some things were postponed. Now things are going back, moving forward, beginning of April. A lot of my programs I watch or involved with are starting up April 1st through 3rd.
Okay. Thank you, Corey.
Mhm.
Nobody else. Okay. So also any other housing updates from our group here? Thomas McGregor, go ahead.
Hi, everybody. Thomas McGregor, the Youth and Housing Project Manager with Peace at Home Advocacy Center, wanting to provide an update on our youth housing campus efforts. We have arrived at a name for the project. So the campus that is located in between Deer Creek Housing Units for NeighborWorks and Eastwood Park will be known as the Lotus Pad. Once again, the Lotus Pad. And so the Lotus Pad will be home to Tasha's House LGBTQ Drop-In Center, Peace at Home Transitional Housing Units for 18 to 22-year-olds. We will have 5 units for rent. This is a duplex household that has 2 bedrooms in one unit, 3 bedrooms in another. We're hopeful to get those transitional housing units online in the month of Gulp April, getting stuff going here. Also, then the other resource on the campus is Family, Faith, and Relationship Advocates, known as FARA. Their Dome Spay program, that is a Latin word for Home of Hope. Home of Hope or Dome Spay will have a crisis shelter for unaccompanied minors 11 to 17 years old. And that is looking like it might slow open May 5th, Monday, May 5th. They're still working through their final moments with ODHS licensure. So exciting stuff happening out as what is known as the Lotus Pad.
That's amazing.
Yeah, that is a great idea that's coming forward that I've personally been hoping for something like that. Where did you say it was going to be, Thomas?
So there is a 1-acre campus in between Eastwood Park and the Deer Creek Apartments along Douglas Avenue in East Roseburg. So this is a neighborhood behind Rifle Range Road and Douglas in that kind of part of Roseburg.
Okay. And you said it's between age of 18 and 22. Is that just the target group?
That's for the transitional housing units. These will be actual rooms for lease. And we're working on finalizing the qualifications for that. So high levels of housing instability or a recent history of domestic violence, sexual assault, but 18 to 22. And then unaccompanied minors would have a bed for stay at Dome Spay, which is there's 3 houses on the property.
Okay. Good deal. I'm happy to hear that. Any other questions for Thomas on his report there? Okay. Thank you, Thomas.
Will there be an open house, Thomas?
Yes, we're looking at maybe having just an internal community, you know, so Douglas, persons such as you all, probably in late May. And then there's been some funders at the Salem level, and you know, they're kind of busy until July 1, and so maybe in July or August, more of a formal grand opening type, and having some outside of Douglas County persons there.
Okay, thank you, Thomas. Very good. Any other questions for Thomas? Okay. Any other roundtable housing updates from any of our group here?
I see
Okay.
Wayne on here. Does Wayne have anything new?
I'm kind of hiding out.
I can see you though. No.
Yeah, I know. It's like
Yeah.
I haven't been going to a lot of meetings lately like this because we've been developing internally for our HRSN program that Katie and, you know, Thomas are part of. But the biggest thing that, you know, I would like to bring light to is Katie, with her leadership abilities, is putting together another collaborative for our folks that are partnered with UHA to do the HRSN program, the one that received the CCBF funding. So like people like us, people like UCAN, people like HIV Alliance, Peace at Home, you know, a couple other folks, because we're talking about the idea of sustainability and like how we can, you know, do the best with this program with the limited resources that we have. But, you know, these resources can only go for so long. So now it's like, how do we come together and create the sustainability piece where we can keep these people housed for the long term? You know, since we don't have permanent supportive housing yet, I've heard rumors of other, you know, like a new cohort coming together to try to create something. But for right now, you know, Katie's kind of like leading the charge on putting people together to be able to create the whole idea of how can we use what resources we have, the organizations we have, find out like who does what really, really well, put it all together and like, you know, create a network of this continuum of where we can help people for the long haul. So I'm really excited about that. But besides that, I really don't have too much except that our community health workers are busy. They're getting referrals like crazy to help all you guys. So, I mean, if you guys have anybody that needs help with sustainability when it comes to rental assistance, utility assistance, climate products, like if they're needing portable heaters, portable air conditioners, portable air purification systems to power banks to anything like that, you can definitely use Unite Us to do a referral out to us. For those products or just the housing navigation in general. NeighborWorks, UCAN, and Peace at Home are all going to be waivered here pretty quick and onboarded to be able to offer those services. And then I have no idea who's doing nutrition, but if you have people that have dietary needs, make sure to use the HRSN program to that ability to help your people out. That's pretty much what I got.
Thank you, Wayne. That's and I agree. The sustainability part is something that we need to really focus on because the initial helps are always great, but sometimes the sustainability is a problem.
Yeah, we've been able at NeighborWorks,
what-
we've been able to take our like evictions almost down to nothing. And it's really just that long-term like peer support. That's the biggest thing. You know, Dane jumped on the bandwagon really early when it comes to peer support specialists, and Adapt has done a really good job at developing their peer support specialists, but that having that person to hold the hands in appropriate places and helping the people do the work on their own, you know, and navigating through that, I think is a huge part of how we could really be successful in Douglas County. So.
Yeah, I agree. Thank you, Wayne. And the fact that the sharing of information and the sharing of resources among our group here, very, very important. So yeah, thanks, Wayne, for that report. Any other questions for Wayne? Okay, moving forward, our community presentations. Corey, do you want to introduce our community presentations?
Yeah, so we have Barbara Hofford here. And actually, Rochelle and I went to a luncheon presentation that she and others held at the Roseburg Public Library earlier this month, which was great. So I got to meet and talk with her. And and ask her nicely if she'd come join our group and do this. We hadn't heard from NAMI in some time, and they had some great information that they offered in that presentation. So I thought it'd be beneficial for this group just to stay connected with them and hear what they do. So Barbara, it's all yours. Did you have a presentation or are you just speaking?
I'm just talking. I don't have a presentation. Chris Binoff, who is our state director, came down and did a presentation for a bunch of community partners. And we're glad that Corey and others came and could hear. So I'm not going to be that eloquent as as Chris was, but I would be happy to share. First of all, my hat is off to all of you. It's so exciting to hear all these things that are going on in our little county. And I thank you all for the work that you do. I think some of you probably knew Marie Dixon. She used to come to the LPSCC meetings. I tell you, she passed away a couple of weeks ago. She'd been on hospice for several months and her heart was still there. Her mind was still there. And for our luncheon, we were putting together some packets and I went over to visit with her and I took some folding papers that I had to do. And she said, "Oh, I can help." So she was in her bed folding papers. And to the very end, she had a heart for working to better the lives of people with mental illness. And I know she really valued your the LPSCC group and always brought us messages. So maybe I'll be coming now to let you know that. Anyway, so the gist of our the luncheon, Chris came to kind of tell you what NAMI Oregon is kind of doing across the state. They have, it's forever been 3 and now 4 people in a small office in Portland that ran the state NAMI. So we're not a big organization and 99% of us are just volunteers. So we, I think there are a few counties that have paid staff like Lane County and probably one of the ones up in Portland. But now we have a Southwest Oregon regional director. Her office is in Ashland, and she has been developing things like a website for us. So now you can go to info@namidouglas.org and find out what's going on locally for us. And through that, you can also find out other supports, which we are excited for because we've been such a small organization. NAMI has a lot of wonderful support programs for people with mental illness and their families. But we just don't feel like we've been able to reach as many people as we would like. So we work at getting the word out about our monthly meeting. So locally, we have a monthly meeting on Mondays, the first Monday of the month from 6 to 7:30. Anyone is invited to that. People who have a mental health condition or their families or loved ones or people just interested in helping people with mental illness. At that meeting, it's kind of a support meeting, and usually if we have someone new coming in, it's because they're having a crisis. So we allow them to tell their story and we offer what help we can as far as just guiding them to resources or whatever they need. And we often will have a speaker. And this next on the 7th of April, I think that's the first Monday, Doug Walton is going to come from ADAPT and tell us about the crisis intervention team and the training, the CIT training, crisis intervention training that NAMI has worked with the sheriff's office and the police and doing these trainings for a number of years. We haven't had one, I don't believe, since COVID. So he's putting together a new training that we try to get all the first responders to attend at least one. It's a 40-hour week of training, and NAMI helps out by providing family members who come and tell their stories of what it was like to interface with law enforcement or whatever and share their stories. And hopefully that's helpful for these people who maybe have never dealt with mental illness from their own perspective, to see what it feels like to be someone in that kind of a situation. So he's going to come and talk about that. And then we just started having a family support group. NAMI is unique in that it was started by a couple of moms who had kids that had mental illness, and they said, we've got to do something, you know, we need help, we need help. So it's a real grassroots organization. And like I said, most of us are volunteers. But the uniqueness of NAMI is it helps not only the individuals living with mental illness, but their families and their loved ones, and helping them know how to navigate what life is like when you have a mental illness, and getting families together to share their experience, so you don't feel like you're the only person in the world that deals with this and this is crazy and what do I do? So so we have our regular monthly meeting which we've had forever at the Vine Street Baptist Church. And again, anyone's welcome to that, 6 to 7:30, first Monday of the month. We just started at the ADAPT office having a family support meeting on the third Thursdays of the month from 6 to 7:30. And it is just for the family members to come. And again, it's like a support group, like, I don't know, I've never been to AA or any of those kind of things, but we have, NAMI is wonderful at providing training for volunteer staff. So we have our guidelines of how we run the meetings. And so we've been able to help a few people at that. And hopefully that word will get out that that's available. Other programs that NAMI has, another one that we do is called Family to Family. It's an 8-week class. We had one last spring, and hopefully, no, in the fall, and hopefully we'll have another one coming up here that is for the family members to learn about the different diagnoses of mental illness, how the brain changes, and it's a medical diagnosis. It's not, you know, something people are just making up or wishing on themselves. Talk about medications. We talk a lot about how to take care of yourself in taking care of someone, because we have to take care of ourselves first in order to be healthy and be able to take care of someone. So that is one of NAMI's signature programs. There's a parallel program called Peer-to-Peer that is a class that is taught by individuals who have a mental health condition to teach others, and they teach similar things. You know, about medications and the different diagnoses, but they have a little different twist on it, as they would need to cope better in the world. And again, to spend time with other people who have, it's a group therapy kind of a thing. Not group therapy, it's just a group support group. There you go. We haven't been able to offer that in person because it's hard to find individuals. We have found it hard to find people with a mental health condition who is stable and able to, and has the heart and the time and energy to put into offering these groups. And that's something we're hoping that we would be able to do. But so far we haven't, but maybe someday. But through the regional, Victoria Sage is our regional director in Ashland. Through her, she's able to kind of pull together when one of the organizations, and Medford has a large organization, if they're having a class and that is available on Zoom, you could go to that, our website, and be connected with Zoom. And also support for people who just need peer support. Again, we don't have anyone here able to just do that. So it's a possibility to have that through Zoom. And we do have people who have come and said, oh yeah, I found NAMI online and I've been attending this support group. We've also had a family member who found a support group and was attending that, and it was very helpful for them. So hopefully through technology, which we all came to love and hate during COVID, it has opened doors of ways that we can connect with people. Another I think, a really important class that we do, and I have taught it in person. I lost my teaching partner, so I'm looking for another one of those. But it is, it's called NAMI Basics. It's similar to Family, only it is for families that have school-age children. It's a 6-week class. And as you can imagine, if you have school-age children, it's hard to get away for a 2.5-hour class. So Chris teaches these classes online, and he said they have had really good luck with attendance online, because parents can stay home, and if they need to run and do something, they can do that and then come back to the class. And he said that's been real effective. So I'm hoping we can get that going here too. If I can't find a partner, then doing it online, we could find someone, whoever, wherever, and offer that. So those are some things that we offer. I don't know what else you want to know about, but online, the NAMI website is very good. It's free to everyone. We encourage people who are interested to join NAMI, because it gives, when Chris is very good about going to the legislation. And of course, right now, funding for everything is, kind of up in the air for many, many things. He's at the legislation a lot to advocate. And that's what NAMI does. We advocate for legislation that's going to help our families and individuals with mental illness. When he goes to the legislation, he can say, this many people in Oregon belong to NAMI, and they are supporting of this legislation. So people joining NAMI just helps our numbers, and that's always helpful. People who join NAMI get newsletters through the email, and they're so good when there is a legislation, something coming up that they're going to be voting on. They'll send a notification, say, hey, NAMI is in favor of doing this or against this. Here's just put where you're at and that into the website. It's very easy to send a note to the legislators that represent us. And I've done that a number of times, and he said that is very effective as far as counting toward how people will vote. So anyway, I just want you to know again how much I appreciate you letting me come and tell you about what NAMI is doing. We're small, but we call ourselves small but mighty, but I'm not quite sure about that. But we've been working with the new behavioral health unit a little bit. They have a lot of our brochures and stuff. They said NAMI has the best brochures that talk about we have different ones for each of the different mental illnesses, and lots of other things that is helpful for. So if anybody has any questions, I'd be happy to answer or whatever.
And if you have any flyers or events you want to share with me, send me an email and I can share with the group.
Great. I will do that. Thank you.
Thank you, Barbara. Very, very important. NAMI is very important to this group. I remember the very first meeting I ever attended on the housing subcommittee. I met Marie. I did not realize that she had passed away, so that's kind of sad. But I met Marie, this has been years ago, when I first joined LPSCC and attended the housing subcommittee, which was the housing subcommittee at that time. But appreciated Marie very much. So thank you, Barbara, for your report. And obviously, sharing information here is our most important idea. So if you keep coming back and sharing with us, we appreciate it. So Corey, you want to introduce Rochelle?
So Rochelle's been on here before, but she is our discharge planner in the Douglas County Jail. We're able to work with WellPath through the federal grant for the Second Chance Act grant through the Bureau of Justice Assistance. Rochelle has been amazing. She started April 2024. So almost a
Thank
year.
you.
We're getting close.
Yes, it's been wonderful. Yes, thank you. So yeah, like she said, my name is Rochelle Capone. I am the discharge planner at the Douglas County Jail, working in the medical clinic. I help folks that are incarcerated connect to community resources or make a plan for reentry into the community once they are released. I can help with things like medical care coordination. So I can help turn on their OHP and activate that the day of release, because I'm a justice involved OHP assister. And then I can also arrange medical transportation covered under OHP to meet them at release and take them to their next scheduled appointment if they have one on the day of release, to enter substance use disorder treatment, to get mental health treatment, I can help coordinate care for a primary care provider, or make referrals to HIV Alliance, DAPT, Chadwick Clubhouse, AANA meetings. I can provide lists for that kind of those kinds of things. I help with shelters, so help with Oxford House applications and interviews, Gary Leaf Navigation Center applications and referrals. I can refer pregnant women that are incarcerated to Safe Haven Maternity Home, a shelter for pregnant women, the Roseburg Rescue Mission I make referrals to, Samaritan Inn. I can help with other kind of limited housing application navigation, but when they're incarcerated, what they need at release is like emergency shelter, something they can access the day of release. But I do try and look forward ahead and help with like Section 8 wait lists, things like that. Also help with transportation. So peer support transport, I partner with ADAPT. I can make referrals to peer support mentors to meet them at release, to provide transportation and resources. Also that medical transportation component. And then I do provide Umpqua Public Transportation District bus schedules with bus tickets to those who need help with transportation. And then I help with employment. So like SNAP employment and training program referrals. It's like the STEP program at DHS. And they can help connect them to work source job coaches. And then I can really meet with people and help identify goals and help them with clothing, Narcan, and other necessities at release. A big component of what I do is MAT care coordination, so medically assisted treatment. There's a MAT program in the jail, and I help them kind of figure out, I give them options counseling, like these are the providers we have in our community that do MAT, which one would you like to choose? And then help make those referrals for them. We partner with Boulder Care, and Boulder Care is actually providing me free brand new phones with 3 months service to hand out at release with Narcan, and get them hooked up with Boulder Care so they can access appointments same day and prescriptions same day once they're released. And so that's been a great resource. But yeah.
Those are excellent points, Rochelle. And the fact that you're getting to them as soon as they are released, I think is very, very important, because there's no downtime there. That's great. And all the services you're providing, the network that you're providing is great. So very appreciative. Any other questions for Rochelle? Great job. Appreciate it. No other questions for Rochelle. We'll move on, Corey, for your roundtable update and your go to the order informational.
Okay. I put on their Oregon Criminal Justice Commission Summit. Robert Wilson, who's on the call, he's the mental health court coordinator. And then Christina Donahue's our drug court coordinator. And then we had 3 folks from ADAPT, Counseling Through Mental Health. They attended as well. And that was March 6 and 7 up in Salem, where we got to meet with other groups doing similar work, and actually got to be in the same room while they were doing a live stream legislative hearings. We got to hear some housing programs that are going on around different areas of the state. It was nice for me meeting jail commanders from different areas, talking with other counselors or folks that do similar work that I'm connected with here. So it was a good networking opportunity. I thought it was a good meeting, and Judge Anne Marie Simmons was there. She did a breakout session. So there were 3 judges that spoke, and they were highlighting some new special things that they're doing in their programs. And Judge Simmons talked about how we've incorporated Thrive Umpqua, which used to be Blue Zones, into mental health court. And it was actually Darlene Brooks from NAMI that spoke up in one of our court team meetings suggesting the idea that maybe they'd be a good option to bring into mental health court. So much of well-being also has to do with what you're ingesting, food-wise. And so we looked into that, and I said, well, I worked with John Diemoff when I was at the city of Roseburg, and I was happy to contact him, and I did that. And we've had several meetings and got them incorporated. We're working on a contract with them, actually, that we will hopefully start as of July this year, because we're kind of waiting for our grant numbers to finalize to see what we can work into the grant. And if we can't, we're working on a Friends of Specialty Court subcommittee to try and fundraise so we can actually pay for some of these different things that are outside of a grant scope. And so that's in its infancy that we're starting. So we don't have a lot of information on that piece yet. But for Thrive, we've done some shopping tours at Sherm's, where John Diemoff has a small group of folks, usually upwards of anywhere from 6 to 9 people. And he just goes through different areas in the grocery portion of, fruits and vegetables in the first few aisles where bulk and organic things are, and trying to really let people know that food is more like medicine, and there's great things you can eat to sustain and feel better and stretch your dollars better rather than getting quick food at markets or fast food. And so it's been successful. A lot of people feel like they're gaining information from it. He provides handouts. And from here, we're looking forward to doing some cooking classes with folks, having walking moai groups and purpose workshops. And I think there might be a wellness or well-being type of class. I'm not sure. We kind of threw out some ideas, so we'll see how it progresses once we get that contract moving forward. So I was excited about that. So that kind of twisted into that, but she was talking about that at the summit, and a lot of people were very interested in how we're trying to incorporate that into courts. It doesn't sound like that's being done elsewhere. I don't know if anyone wants to see the disposition calls of service, and still the calls to 911 are really low. As Cheryl reports, her calls to 988 crisis are, staying consistent, which is what we want to see. We've had 0 arrests still through the 911. I do know they're giving more tickets for people camping. As Janelle's report on the H tag side of things, they're trying to work with the city, trying to make sure for those that are set up as a client with somewhere, that they try and keep them in one place while they're working on services. And I know the relationship that way has been going on. That's all I have for that.
So the you'll send out those numbers, all right, Corey, on the disposition calls for service.
I did with the agenda. I can resend it when I send the notes.
Yeah, thank you.
Or I can show it on screen. I can show on screen real quick if you want to see it. I have it on my computer. Did you want to see it real quick?
I got it. I see it in the minute or the agenda now, so that'd be okay. Yeah, but I share all the things that we put on the meeting. I share them, so I just want to make sure that we get them all at the end of the meeting, and I know you send them out very well, so thank you.
Yep. And I do have information from Dane that I'll send once I receive Cheryl's. I'll include that. I sent the flyers for drug court projects with the agenda as well.
Okay, so the drug court graduation is what now, Corey?
It's going to be May 13 at the fairgrounds. That's back to a Tuesday, and it'll be at 5:15 p.m. in the Cascade Hall. And we average about 200 people at the graduations. We'd always love to see bigger numbers. Judge Johnson said he's working on obtaining a speaker this time. Last time he didn't have a speaker, he just chose to speak. So sometimes he'll just run the show, and other times he'll invite someone. He hasn't told me the name of the person yet. He's out on vacation this week. So we're still tightening up details, but I did finalize the flyer. So that'll be posted to the drug court page as the subpage under lipstick on our website. I do have all of our program flyers on the website too, for the community projects for the drug court graduate hopefuls.
Okay. Yeah, I saw those. Those are great. And the fact that there's so many different people doing different things and all of them very, very community oriented. So very good.
That's what we try to.
Yeah. Any other updates from our members here that we need to share? Because this is where we share all the information that we have, and everybody gets something going forward that they can help with.
It's not an update, but I want to say happy birthday to Eric Fromdahl, our juvenile department director. Yeah, don't shake your head.
He's 39 again, right?
I've been waiting for this one for a long time. I am 55 and it is my retirement birthday. I'll be 55 when I retire.
Wow.
So the
55.
first one in a
Wow.
long time I'm actually happy to see come. So thank you very much, Corey.
You're welcome.
Ogre.
Sorry to throw that out there. I did
Happy
see
birthday, Eric.
I did see Jesse put a couple files in the chat, so I clicked to download. I'll send those when I send the notes out.
Thank you, Corey. Very good. I saw that too. I didn't share. I didn't see him I just saw him in the notes. I didn't actually see the file. So if you could share those, that'd be great. Anybody else have anything they want to share with the group? Okay. Our next meeting is April 22nd, same time, same place, 11:30 right here on Zoom. So everybody have a great day and get out there and enjoy this sunshine. It ain't gonna last very long. So have a good day, and I'll adjourn the meeting. Thank you.
Thanks, everybody.